Good afternoon, everyone. We will be getting started in a few minutes.
For those of you that are just joining, we have about 22 people now. Thank you all for coming. I've put in the chat box just some information to get started. And for attendance purposes, if you could just type in your name and then where you work and where you're coming from, that would be great.
Hello, everyone.
Good afternoon.
I'm cooking lunch. I hope to have it done before we started, but there you go.
That's all right.
Is everyone introducing themselves in the chat?
Yes.
Hi, Jamie. Joan.
So I think we are going to go ahead and get started. Good afternoon, everyone. Welcome to Lunch and Learn with the Health Education Committee, Connecting for Heart Health. I know we can't see everyone, but being that today, sorry about that, but being that today is National Wear Red Day, we hope you all are wearing red to show your support for the awareness of heart disease. My name is Chantel Archer, and I am one of the co-chairs of the Health Education Committee, which is a committee of the Connecticut Public Health Association. Before I continue, I would like to remind everyone to please keep yourselves muted. We would appreciate if you would enter your names and organization in the chat. And during the information sharing and question segments, please put any questions or comments in the chat box. You may also click on the raise hand icon at the bottom of the screen, and we will call on you to ask a question or share a comment. Also, we would like to thank everyone who had the opportunity to complete the survey on how much you know about heart disease. And finally, this Lunch and Learn is being recorded, and both the presentation and recording will be available on our webpage. The Health Education Committee has existed for many years, and through this committee, we hope to inform, educate, and empower people about health issues. We also hope to increase the competency, skills, and performance of the public health workforce as they relate to the 10 essential public health services. And finally, we hope to provide networking opportunities for public health professionals. So throughout the year, we plan to host a series of lunch and learns on various health topics. And we're really excited to kick off this series with a lunch and learn dedicated to heart health, which features a presentation from the committee's very own Jamie Luckhardt. Before I say more about Jamie, I wanted to let everyone see what we will be covering during today's lunch and learn, which will include a discussion on symptoms of heart disease, risk factors, warning signs, as well as an information sharing segment where participants will be able to share their efforts to educate populations about heart disease across the state and beyond, as well as share information about heart health resources. And now more about our featured presenter, Jamie Luckhardt. Jamie co-chairs the committee along with myself and also happens to be a 2-time heart survivor who was diagnosed with heart disease at the age of 26. Currently, she is a COVID-19 contact tracer with the City of Meriden Health and Human Services Department. During her career in public health, Jamie has interned at the American Heart Association, working collaboratively with the Connecticut Department of Public Health to evaluate data from the Check It Challenge, a national blood pressure symposium. Jamie is a certified health education specialist dedicated to educating her community on the importance of heart health and healthy lifestyle choices. And with that, I am now going to turn things over to Jamie.
Hi, everyone. Good morning, or good afternoon now. It's noon. I hope everyone is doing okay. And thank you so much for joining us today. It's a pleasure to be here. Before we get into the presentation, I wanted to just share a quick story, a personal story with you guys. So when I was 26 years old, I was actually diagnosed with heart disease. I was living in Boston at the time and life was great. I had a house full of roommates and I was going to school. I was young, I was healthy, I was training for my first marathon. I remember the day vividly. I went out for a run in the Boston Common and my heart rate started just climbing and climbing as I was running. And I got very out of breath. I couldn't catch my breath and it was very scary. And I slowed down and, you know, I was holding on to my chest and kind of like, what is going on? My heart wouldn't slow down. She was like, all right. And I just remember telling her, I don't feel good. Then I know she was helping me to Tufts Medical Center to be evaluated. And it was there, you know, I was there all day fasting and they were giving me my options of for the rest of my life or having a heart surgery. So that day I was actually diagnosed with, so you guys, but pre-ventricular. So it comes for every single heartbeat that I was having 3. So that was putting a strain on my heart. The diagnosis that I wanted to have the surgery. So I went in for days later, and that consisted of a cardiac catheter ablation. What they did there was they inserted these little thin like shears through my femoral artery, all the heart. It's actually that they can do stuff like this, but they through my heart and they of my heart that working properly. Ablation also means burn, so they're burning parts of my heart to try to fire the electrical currents in there. I was able to, you know, a couple days later and wasn't until I got home doing my rehab, symptoms had come back stronger and I was fainting. It was
So I think we momentarily lost Jamie, but she should be back soon once our internet connection is reestablished.
I was having trouble hearing her. Was I the only one? It was like intermittent.
Yes, she is breaking up a little bit.
I don't know if she could be advised about it. I don't know what she could do about it. Hopefully it'll come back better.
Can everyone hear me?
Yes,
wasn't-
Jamie can.
It was breaking up before, Jamie, even before we lost you, but it sounds better now.
Okay, I'm not sure what happened, but if everyone can hear me now, I don't really know where I left off, but I will be very brief. So I had the surgery, my symptoms came back. Long story short, I needed a second surgery. So I went in for.
Jamie, it might help if you stop sharing your video. That might help. I'm wondering. I think she's going to try signing back on.
Hi, can you hear me?
Yes, Jamie.
So sorry. I'm having some technical difficulties over here. I'm extremely thrown off now as to what I heard or not, but I ended up having a car. I started my rehab program. The point I want to make very clear to everybody, it doesn't matter or anything, but a lot of symptoms, any of this happened, and ignored all of those signs. I thought that I was just having anxiety or that I was just doing out. I frequently had skipped, missed beats. I would like for no reason at all. Just weird things that I just thought there's nothing wrong with my heart, and healthy and training for a marathon. So you just don't those types of things. As a health education, just dedicated to work with my community and educating of heart health and encouraging everyone to, take a look at your own, numbers, your blood pressure, your cholesterol, those, your glucose number. Those are key indicators of heart health that you know. And it's really important to be an advocate and, utilize your and be an advocate for your own health. And if you think that's something, better than anyone, if you think something is wrong, then I encourage you to speak up with your healthcare provider. And I hope you enjoy the presentation.
Jamie, just letting you know that I proceeded to the next slide. What is heart disease?
I can't see what is going on. It's okay. Now I can see. Okay. Sorry about that, everyone. Technical difficulties, right? And we're all just trying to do our best here, and it just gets you thrown right off. So I don't know what anyone heard, and I'm really sorry. I'm available for questions afterwards if you want to hear more about my story or anything. But okay, so we'll get started with our presentation. So heart disease is a wide range of conditions that can affect your heart. So some different types of diseases would be, coronary artery disease, also known as CAD, which is a blood vessel disease. There's high blood pressure, cardiac arrest, congestive heart failure, arrhythmias, which is what I have, stroke, congenital heart disease, which is a heart disease that you can be born with, and heart infection. The good news is that most heart disease can be treated with healthy lifestyle choices. So some symptoms, as I was talking about in my presentation, can include, chest pain or tightness, pressure, feeling just very out of breath. Just simple tasks like walking up the stairs can make you feel really out of breath. Pain, numbness, or coldness, like in your hands or feet, is very common. Women especially will have pain in their jaw, neck, or throat, upper abdomen, or back. A fluttering or racing of heartbeats, dizziness or fainting, bluish skin tone, which would mean that your body's not getting enough oxygen, swelling in your legs, or extreme fatigue. Some complications from heart disease would be, heart failure, stroke, aneurysms, artery disease, or cardiac arrest. So some risk factors include high blood pressure. So risk factors for heart disease would be high blood pressure, high cholesterol, and smoking. So they still remain the top three today for heart disease, but lifestyle, age, and family history can also increase your risk. So those factors, age and family history, cannot be controlled, but you can take charge in other ways by, changing your daily lifestyle habits. So lifestyle choices put people at higher risk, and they include, an unhealthy diet, eating lots of salt or sodium, being overweight, not keeping your BMI in check, having diabetes, a lack of physical activity, especially with all of us, we work so hard, but we do sit at a desk all day. So it is important to just get in some steps or that physical activity. Alcohol consumption, high, which we manage right now at this time in our lives. So the chart that I got from the American Heart Association, I love it because it's it gets right to the point. Is something that I worked on, health director at the American Heart Association. These are just some blood pressure. So you can see that you're around 120, less than 80. Elevated goes up 20 to 129, less than 80, and the rest of the stages here. I do encourage you all to know your numbers, your blood pressure numbers, because your blood pressure all the time. It could be different in the morning, it could be different at night. If you have any procedures, it would be great to know your average blood pressure is. So if something is wrong, you can be an advocate for yourself and say, like, my blood pressure is normally 120 over 80. This seems a little high. Can we recheck it again? Facts and percentages is a little outdated, 15, but I got this from the CDC, and this just shows that heart is still the leading cause of death in every ethnic United States. So take a quick look at the graph here that I created. That the totals in are a little bit higher the different racial or ethnic there. Every year that 800 American attack in States has a heart attack every 40 seconds, which is significant.
I think we may.
So, lose me again?
Oh, I hear you, Jamie.
Okay, I think I'm recording, but so this was something I found on the American Association's website. A wonderful resource, anything heart health. Of this little graph here because it kind of shows the most common signs. Some of those would include pain or discomfort in your chest, lightheadedness, nausea. Again, I said before, women usually experience all these symptoms, but something that distinguishes women's symptoms would be jaw, neck, and back pain. Discomfort or pain in your arm or shoulder, especially your left shoulder. Shortness of breath. If you ever experience, or any of your patients, anybody in the community is ever experiencing any of these signs, it's important to call 911 right away. And then, so we're listening to this and we're like, well, what can we do? Can heart disease be prevented? So there are many factors that can, and reduce your risk of heart disease that you can just implement into your daily lifestyle. So some of those things would be, not smoking. Just, quitting smoking alone can lower your risk for heart disease by up to 50%. That's huge. Maintaining a healthy weight. So like I said, it's important to understand, your BMI and what a healthy weight means for you. Getting plenty of physical activity, the recommended activity level is 150 of moderate activity a week. And don't underestimate walking. Walking is a wonderful exercise that is pretty much free. All you need is a place to go and a good pair of sneakers. And it moves every muscle in your body and really helps your cardiovascular system. And then it's important to reduce your stress and eat a nutritious, healthy diet that's low in saturated fats.
So now I'm sure most of us in public health are aware of what the social determinants of health are. These are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health and quality of life outcomes and risks. We also understand the importance of addressing the social determinants of health with the understanding that our health is not only determined by our own individual behaviors, but also determined in part by access to social and economic opportunities, as well as resources and supports available in our homes, neighborhoods, communities, etc. Now, in order for us to create heart-healthy communities in physical environments, it's really important that we make changes to our social environments. In the past, health promotion efforts for heart disease and stroke have traditionally used a health education approach focused on behavioral risk factors such as hypertension, elevated blood cholesterol, cigarette smoking, etc., which Jamie had mentioned previously in the presentation. So programs and interventions for these risk factors were designed and implemented based on what was known as a health education paradigm. But if we want to create heart-healthy communities using a social environment paradigm, we need to create programs and interventions that focus upstream and attempt to directly modify social environmental conditions in order to positively influence human behaviors and consequently disability and disease. Increasing excise taxes on cigarettes or enacting local ordinances limiting smoking in restaurants are two examples of how we could do this. And I'm sure you can all think of other ways as well. For example, if we were interested in decreasing the percent of people who develop high blood cholesterol, we could achieve this by creating healthy food environments, healthy recreational environments, as well as wellness programs at work and school. And those are just a few examples in relation to lowering high blood cholesterol. With that said, I am now going to turn things over to Taylor Williams, who will facilitate the information sharing segment of the Lunch and Learn. Taylor?
Thank you. Hi, everyone. And thank you again for coming out and taking a moment out of your lunch break to participate in this webinar. And you've heard a lot from us today. Thank you, Jamie, again, for your presentation and pushing through despite technical difficulties. And yeah, now we kind of want to hear more so from you. And just to throw in there, I mean, as a current student, I think hearing from people who are in the field, as a person who's interested in pursuing a graduate education in public health, I'm really excited to hear what you guys have to offer during this information sharing component. So firstly, we want to start off with what programs are being implemented in your respective areas. I did see in the introductions that we have people from all over in Connecticut and even out of Connecticut, if I'm not mistaken. So we'd like to hear about some of the things that are happening concerning heart disease prevention efforts. And feel free to use the raise hand function as we mentioned before, and we'll call people accordingly.
Taylor, I can start and give one example. I know when I worked at a different health department in Naugatuck Valley, Jamie helped put together a walking challenge. Like she said, it is very important to just get out there and move your body, and just being together, working on some sort of challenge with others helps get people motivated to get more active in their community and for themselves as well.
Awesome, thank you for sharing that. And has anyone else seen any potential programs like this being implemented in their respective areas, or have any ideas about things they'd want to see? I'll give it a couple of moments to give everyone a chance to think.
Hello, everyone. So I am also currently a student pursuing my MPH. However, I do work with the Village for Families and Children, which is a mental health agency in Connecticut. So some of the things that we have implemented in our programming have included providing healthy workshops where we teach the students and the parents to cook healthier meals. So a lot of our parents are from urban areas and are people of color. So that being said, we tend to use a lot of high sodium products. So as a result, we learn how to, interchange, seasoning. So instead of going for like the adobo, we teach them how to use, fresh herbs and other seasonings, as well as pointing them to different resources within the community, such as markets and different places that they can get fresh fruits and vegetables. So from a more baser level, we implement it in our after school programming, as well as educating the parents to make healthier choices.
Awesome, thank you for sharing that,
I
Tina.
just have something to add about that. Was that cooking?
I didn't hear you, I'm sorry.
Okay, I'm not sure what happened. There may be some more technical difficulties, but I was just saying thank you so much, Tina, for sharing that. It kind of goes into the second question, talking about barriers and using the social determinants of health and being thoughtful about the backgrounds and the cultures and the social factors that go into building those healthy lifestyle choices. So that's actually a perfect transition. And I actually saw that Brady Lucas shared that they were also part of a walking challenge. So thank you for sharing that. So in transitioning to question 2, again, what barriers to care have you seen in your work? And I actually think we saw Tara Lutz bring up those essential questions. So thank you for pointing that out. And we actually kind of want to address that a little bit more with this question. So what barriers to care have we seen, and how can we use our understanding of the social determinants of health to address these barriers? So Tara, if you kind of want to speak more to your questions, we would love to hear more.
Hi, sure. Thank you for this presentation. Nice to see some familiar names. So this is the professor, the educator in me coming out, posing those types of questions. And part of what I teach is actually with medical school students. And we're working to actually try and change that curriculum because so much of it is, for lack of better words, white centric. So when we teach people to look for changes in skin color, we're not really talking about all of our patients. So we're teaching a disservice. So that is just kind of one very small but really powerful example of how much work we need to do to allow for equitable environments so everyone can be healthy, right? Providing education about how to cook healthy and get outside and walk. That's great if we all can do that, but so many of us can't. So I would love to hear what you all think and continue to hear about what different groups are doing to kind of address these more upstream systems level challenges to being heart healthy.
Thank you so much for bringing that up, Tara. I really appreciate it. I'm so happy to hear that you're pushing and other people are pushing more for that to be included, especially in medical school curriculums. As someone who is interested in medicine and hope to pursue that in addition to a public health education, I am well aware and super happy to hear that. So thank you again so much. So are there any additional comments or observations concerning this question? Let's check the chat. I see Natasha Austin has mentioned that they've seen many barriers related to advertising or marketing the programs for the communities in different communities. And that's also relevant as well. I think that's why health education and health promotion, being super aware of your targeted audience is super important as well. So thank you for sharing that, Natasha.
This is Maya Welfare speaking. I would just like to add, I'm located in New Haven, Connecticut. And I would just like to add that in addition to the issues with marketing and advertising, as well as including populations of darker skin color in research, as well as in when talking about signs and symptoms, I think that in addition, we are now dealing with COVID, and COVID has been the forefront of discussions about health. And so I know even within my community, people are questioning, like, well, what about cancer? And what about diabetes? We don't hear that talked about anymore. Like, that didn't just go away. And so we, I think, need to rediscover how to address social determinants of health as it pertains to all pre-existing health conditions while integrating COVID and how COVID impacts all communities instead of just now turning towards COVID. Because I know here in New Haven, like, yes, we're facing COVID, but now we're also looking at an increase in crime. Mm-hmm. And we're looking at, how do we help families of lower socioeconomic status survive the times? And so because of all of that, we're not looking at heart disease. We're not looking at ways to address mental health or healthy ways to diffuse stress. And so, again, like Tara said, there's a whole community that is carrying a huge burden of stress that's being forgotten about because they're not receiving the public health services, prevention services of, heart disease. And I know today is like Wear Red because it's Heart Disease Awareness Day. And I haven't received any kind of notification from the city or any kind of campaign around heart health. I just checked the New Haven Health Department, and on the front page, it's a COVID blast. And I know there's room to add information about, heart health since it is Awareness Day. So that's just something I would like to add. And another quick thing that I would like to say is that, we in New Haven, I don't think are getting enough information about other health factors or other pre-existing health conditions besides COVID. That's all we're receiving. We're heavily saturated with that information. But I know that I personally use social media, particularly Instagram. I know that Men's Health and Women's Health Instagram pages, they have actual videos of exercising that are free, and they save them on their page. I think it's like they save it under the Instagram TV. So for those who have access to social media, we can engage in that way. But for families and communities that don't have access or the time to actually engage in fitness in the middle of the day, it becomes a challenge. And I think that we need to revisit how we provide prevention services and programs to communities that are most at risk, even when we talk about COVID.
Awesome. Thank you again for sharing that, Maya. I think it's definitely important to consider how COVID affects people when they're dealing with other diseases or things that they've been exposed to. So I think thinking along, more than one dimension is definitely a critical aspect to that. And I agree, we're definitely extremely saturated with information about COVID. And there's really no excuse. I mean, as public health professionals, as medical professionals, I think a lot of people should be well aware that there are interacting influences. So we should definitely not elevate COVID for the sake of targeting that and then forgetting about everything else. So thank you for bringing up that critical point. And I see that Tina also agrees with you. So we do see that Joan and then Tess also had comments or questions. So Joan, would you like to make your comment or ask your question?
Yes, thank you. I didn't see the raised hand, so I raised my hand. I work at Naugatuck Valley Health District, but I also work at Southwest Community Health Center in Bridgeport. And I think one of the, in a funny way, sort of the silver linings of COVID has been that organizations like Southwest and, all sorts of healthcare providers are looking for doing much more in the way of remote patient monitoring. And this has really been triggered by the fact that people are confined to home, whether they have COVID or have been exposed to it or just want to stay away from it. And so we're really in the business of putting blood pressure monitors and glucometers and thermometers, all sorts of things in patients' hands at home. And many of these things are covered by insurance, including Medicaid. And so it really enables people to get services for some of those chronic underlying things, as well as COVID, without having to be exposed and without having to deal with transportation barriers and childcare barriers and all sorts of things. So I think, it really has been a positive outcome. Same thing with telehealth, really. That so many more people at Southwest Community Health Center, we went from no telehealth to about 85% of our visits at one point. And now we've kind of backed down because we're opening the doors a little more, but it's still about 60%. And that's a huge impact on access, giving access to care.
Yeah, that's awesome. And that you touched on exactly what I was going to say. When I was volunteering at a community health clinic in Hartford, one of the medical directors was talking about how telehealth is getting increasingly popular amongst their Hispanic patient population, which is what they predominantly serve. And it's definitely helping to decrease those access barriers. So I'm really happy to hear that that's being spread all throughout Connecticut. So thank you for sharing that, Joan. And Tess, we saw that you had a question or a comment as well. So can you please share?
Yeah, I wanted to talk about another barrier, transportation. So I work at the Bridgeport Health Department. I'm the Food Policy Council Coordinator. So I coordinate different programs to increase food access for people in the city. And one of the projects I work on is the Healthy Corner Store Initiative, where we work with corner store owners and provide them with refrigerators so they can sell fresh produce to people in food desert areas in Bridgeport. Because, it's easy to tell people, oh, eat healthy so you prevent heart disease, but a lot of people can't do that or they don't know how to, right? So for these people living in the food desert areas of Bridgeport, we provide, we're giving them an ability to go purchase fresh produce, like in an easier way for them. So they don't have to take 2 bus transfers to Stop and Shop across town. They can just walk down the street and they can buy fresh produce. So that's like what we're working on. Just trying to break down those barriers so people can live so they can live a healthy lifestyle in Bridgeport.
Yes, another critical point that kind of bounces right off of Jones, just that access and just making things to live a healthy lifestyle accessible. You know, I feel like when we say, you know, these bullet points, eat healthy, you know, make sure you're managing your weight, do all of this. It's like these are these directions that people are like, I don't know what that means. So, or I don't have the access to do that, you know, especially if you live in a food desert. I mean, how can you tell someone to eat, you know, salads or like eat your fruits and vegetables all the time when A, they can't get there, or B, can't afford it, you know? So I think these are all super important points, and I'm glad to see that it's spread all throughout Connecticut. So thank you for sharing that as well, Tess. And let me just check the chat really quick. I just want to make sure I'm not missing anyone else. Okay.
Then I have one more thing to add on to what Tessa said. I work up more towards in the Middletown, Middlefield area, and I've been working with a health enhancement committee or community, health enhancement community as well. And we found that same issue that people know that there are healthy foods and there are healthy things available for them, but they don't know where they are. So they're kind of working on an app that'll put that all together and hopefully an easy access to see how to get to the healthy food and how to get to the activities all in one place on an app. So new things are coming too to share that information.
Thank you, Dina. I also think just from what I've seen and just what I've experienced in health education and community engagement, I think also figuring out ways to expose people to the value of scientific research is also super important, just because if they're empowered enough to seek out those resources on their own, I think that is a great way to change health behaviors, just kind of giving people that agency. So I think that's another point I wanted to add in. And it is 12:41. I just want to check in. How are we doing on time?
So we have about 15 minutes left until we should start wrapping things up.
Okay, awesome. So for question 3, I know we kind of covered a lot of that as far as what we've done to educate populations about heart disease, especially communities of color and other vulnerable populations. I feel like a lot of people have made some awesome points on that. Were there any last questions or comments about that? I don't want to be too repetitive.
Taylor, it's Jamie. I'm not sure. I came on with my cell phone because I'm having some technical difficulties, but I just, I've been listening to every,
We're losing you
you know,
again.
put out. Huh?
I said, we're losing you again. You cut out.
Oh my God. I'm so sorry.
No, that's okay.
I have full service, so I'm not sure why this keeps happening to me. But I want to make a point that, you know, a lot of the things that we were talking about has to deal with policy change. And it's important in 2020 with everything going on, especially with the structural racism and the barriers to care, the social determinants that we are talking about here, you know, to fight back with these systems, these laws and customs that are perpetuating inequality. There's so much work to be done. And, you know, if we were focusing on the health and the impacts through the conditions where, you know, we live and work, we can teach individual prevention. I'm just throwing out some other ideas here that maybe can reduce some of these barriers to care. And it is unfortunate, but there's tons of work that we could all be doing daily with this.
Awesome. Thank you for sharing, Jamie. Okay, so I'm going to move on to question 4 because I think it's super relevant and important now since we're in this online and virtual learning environment for the majority of us. So how can we be innovative in our approach to using health education to prevent heart disease in particular, especially in a virtual learning environment, obviously inspired by COVID. So I know COVID is kind of a part of that conversation. So yeah, what do we think about innovative approaches?
I think first and foremost that we should all have an excellent Wi-Fi to be able to connect to.
I thoroughly agree.
Sorry.
That is very difficult. Okay, I see we have a question from Kay. Okay, I'm not muted. Kay, please share. Sorry.
No, definitely. And this has been so fascinating to hear about everyone's different line of work and experiences. So I really appreciate everyone sharing today. So I live in New Orleans, and we have a lot of different age ranges in accordance with heart disease. We have a big older population, but also a younger population that deals with this issue. And something that we've kind of been interested in using with our approach is thinking about the diffusion of innovation theory in public health, where you think about the early adopters, the laggards, and the late adopters, and where different groups fall within this approach. And so one of my coworkers is doing a study where they are using reminders through the prescription refills at their local Walgreens to remind individuals not only to pick up their prescriptions to manage their heart disease conditions, but to also get out, get moving, and to eat healthy as well. So it's just really nice to know that there are innovative approaches, but in consideration to where people stand within the diffusion of innovation theory, where there could be younger generations who are more willing to use a Zoom platform. And there are some, like, even I know my family, there are some family members who do not even want to engage on Zoom. So it's going to be interesting how we meet everyone where they are, but not force anyone to a certain place where they feel uncomfortable or use technology that they're not familiar with.
Yeah, I think that is a big challenge, right? You have these differences in generations. But I did want to comment on the innovative technique that you mentioned before with the prescriptions. I think that's awesome. I never thought about that. And I think it's just such a little like nuanced way to just, instead of just reminding them about the medicine, reminding them like, there's also these other amazing things that you can do, simple things that you can do in order to, manage your heart disease. So thank you for sharing. And then I also wanted to say, as Dina has mentioned in the chat, welcome. We didn't know that this would reach all the way down to, New Orleans. So thank you for coming and sharing about what's going on in your respective area. We really appreciate that. Are there any other?
I would just like to add, this is
Oh.
Maya. And Kay, that was really great. Thank you for sharing. Because I was thinking, there's a lot of remote learning, and it seems that there's challenges with getting the kids, or there's challenges with retention. And so I was thinking maybe, thinking about integrating health education in early stages in children's lives. Maybe the schools can host a campaign where they have a contest to get kids to maybe engage in physical activity for a certain amount, or the person who engages in physical activity the most for the month of whatever, they win a prize, or the class wins a prize, or the school wins a prize, however, at whatever level they want to do the rewarding. But I think that engaging the kids hopefully will then engage the parents. And then I know that there's My Chart. I don't know if that's a universal platform, but similar to what Kay was saying about how they use the prescription services, that they should use My Chart as a way to communicate health education, because they definitely communicate when it's time to make an appointment, or they would communicate when your test results are in. And so I think that that's a great way to communicate health education. And they can use like an interactive platform where it's like, this is some information, maybe question and answer, or something fun and interactive to allow people to really comprehend the information and remember it. And I think I forgot the last thing I was going to say, but those are some of the things that I was thinking, that, you already have platforms to engage people. I think that we need to begin to use those platforms for health education. And I am pursuing my master's in public health, and I was working on a focus group research within the community of New Haven. And one thing that I thought about is that we were looking at how environmental health impacts the community's exposure to COVID. And I was just thinking about how advertisement on TV, like when you turn on the TV, you see advertisements for fast food like every other commercial. And I think that we need to begin to integrate just at that same rate of advertisement, integrate health education. And then you begin to instill in people's mindset that, you know, health is important, and that maybe running to Burger King to get a burger that looks so juicy on TV isn't the thing to do. And instead, maybe go outside with, you know, if you were, because of COVID, if you're in a pod, you have a pod of people, go and work out, or go to the nearest track and practice social distancing and still work out, or work out in your living room. And so we need to begin to get people excited about health, and getting them to understand that health is wealth. And if you're healthy, then you're able to really enjoy life and feel good about yourselves and your loved ones. So that's what I think we need to do in terms of innovative thinking, because we already have the platforms. I just don't think that we're using them to the best of our ability. And when I say our, I mean like on a healthcare perspective, not just public health, but just healthcare practitioners, public health, allied health, whatever. If you have a population, we need to begin to think about engaging and integrating health education.
I agree. I was just going to say, Kay responded to you and was talking about, especially with the Super Bowl. There's a ton of advertisement going on with the Super Bowl, right? But a lot of it is fast food. A lot of it will be Burger King or McDonald's, like these huge global chains that kind of take over the advertisement in the Super Bowl, and big events like that have huge audiences. And it seems like it's a reach, and it's not that big of a deal. Like advertising doesn't make that much of a difference, but it really does. And I think all of us know that, of course. But I think going back to what you mentioned about schools, I just wanted to comment. I think that is super important, just because it reminds you that, schools are like a essential component to like engaging communities, because then you get parents and families involved. And it's a great way to start, especially with young children. So I thoroughly agree. And thank you for sharing that in all of your thoughts. We really appreciate it. Were there any other comments or questions? I'll give it a moment. Okay, doesn't seem to be. And we have 9 minutes left. I know some people were mentioning some of their favorite heart health resources as far as using online platforms like Instagram. I know Kay mentioned a great heart health resource. So just for the sake of time, I wanted to end with what would you like to see more of from us, the Health Education Committee, going forward? There were tons of great ideas from people even outside of Connecticut. So definitely got the wheels turning a little bit in my head as far as what we can do in Connecticut. But I would like to hear from everyone as kind of like an ending question.
I would like to see a symposium on autoimmune diseases. There's been very little research on the number of deaths. There's more than 100 different types of diseases. They have a disparate impact on women. And there may be tens of millions of people in this country who have autoimmune diseases.
Mm-hmm. Awesome. Thank you so much for sharing that with us. So symposiums or more information on autoimmune diseases, and maybe some gender disparities. So that sounds awesome. Thank you.
I just have a quick question. I think these platforms are excellent, and I enjoy hearing other people's input in the works that they're doing. So in the future, is it possible to kind of collect maybe Instagram names or Facebook names of participants, so that way we can create a list of like, these are the participants, and if we as the participants or the listeners want to contact other participants later on, at least we have some kind of contact information?
Yeah. We were actually talking about that in one of our meetings. So thank you for bringing that up, Maya. I'm glad to see that people are interested in doing that. That was a thought that we had.
Yep. Okay.
I'm Sue Troop, and I'm the state advisor for HOSA, Future Health Professionals. So I work with high school and college students, and we have partnered with Connecticut Public Health Association with the walk. And I was thinking that if there's a way to get a copy of this, I could share it with, we have chapters all over the state, and they're based mainly in high schools. And then we have 3 universities. We have UConn, Storrs, Yale, and University of New Haven. So if there's a way to, it's recording, I could see maybe the teachers sharing it with the students and maybe discuss, they could stop and discuss. But it's already a population of students that want to go into healthcare. And my feeling is public health really cuts through any, no matter what kind of healthcare you want to go into, public health is a huge umbrella that really, intersects with all the different career paths.
Yeah, and I will have you know, this is recorded.
Okay.
If you do want a copy, I'm sure we can work that out. So yes, glad to hear that. Thank you so much.
Yeah. Oh, and one other thing, I'm visiting in South Carolina, so I'm getting this. I am currently in South Carolina for a visit, so you're reaching South Carolina too.
Awesome. This is amazing. This is the first one that we've put on, and we didn't know how, the scope, and we're glad to see that we're reaching places like New Orleans or South Carolina. So thank you for sharing that. And yes, we're ending our time. I would love to hear much more from you all, but thank you for coming. And I'll turn it over to Dina to kind of conclude us.
For sure. Thank you, Taylor. Our information is up here on the slide. Like some of you mentioned, you would want some more time to connect with others. So if you wanted to reach out to one of us, we can kind of start making that list of, adding some links to the chat box, making that list of connections that people can make. And hopefully the 4 of us from this presentation can start you off on those connections. And we've kind of gone through the chat and questions that we've had, but I think this is just one more time to reach out and ask if anybody has some last questions or comments about just the program in general or the topics that we've covered.
Dina, this is Kathy Trott. I hope you don't mind, but I just posted in the chat. There is a program on February 20th, sponsored by CPHA's mentoring organization on request committee. There will be 3 CHES credits offered if anyone is interested. So I thought this would be a good group to promote this in. So you can register on Train. If you have any questions, people can just contact me. I put my email in the chat. And this was a wonderful program. I'm just so impressed with all the really robust exchange between everyone on the program, sharing, questions and their experience. It's just wonderful.
Yeah, thank you, Kathy. I definitely think when we started planning this program, we really wanted to foster an environment that people can connect and then talk more too. So sharing that other program and your contact information is definitely appropriate. Thank you. These are just some references and resources that we wanted to share with everybody. Some of them is where we got our information for the presentation, and then others are resources that reference and can go back to Heart Health as well. We can send these out to you afterwards if you want direct links, but I suggest taking a screenshot or a picture of the screen. That has really helped for me. You can leave it up there for a little while longer.
And I just wanted to say again, this is Jamie. Thank you so much to everybody who took time out of their day today to come see our presentation. This was wonderful to share all these resources, and I do apologize in the beginning of my internet cutting out. But thank you so much, and please complete the evaluation. We appreciate you all for coming.
Yeah, thank you. Thank you, Jamie. That was my last point as well. There is an evaluation. The link I put in the chat box. And then also, if you are interested in getting those CHES credits for the participants here, there's also a link to a Google Doc that more information will have to be put into. And then just on behalf of everybody and CPHA and the Health Education Committee, we want to thank people for coming. I'm not sure if any of the other committee members have some last minute remarks, but we'll probably stick around for a little while if anybody else has some more questions or comments.
Hi, Dina, it's Chantel, and I'd also like to echo both you and Jamie. Thank you for participating in our first event of the year. It's been a while, and we hope to see you at future Lunch and Learns and other events that we hope to host. So thank you again, and remember to complete the evaluations.
Yeah, thank you. So I think that's our official sign off if people have to head back to work. But the core members of our group will stick around if anybody wants to ask some questions in private or at the end. Have a great day, everybody, and a good weekend. And also, I think the four core of us members, if we could stay together